Hi, if you have symptoms like constant fatigue and tiredness, an unexplained sudden increase in your weight or a reduction in your weight, or you have a lot of sensitivity to cold, you feel very cold when others don't, then your doctor may have advised something called the Anti-Thyroid Peroxidase Antibodies test. And today I'm going to tell you everything about this test. So first of all, what is thyroid peroxidase? We are talking about a blood test that measures something related to thyroid peroxidase, but what is this thing, thyroid peroxidase? Where does it come from? So you may be aware that you have something called a thyroid gland, which is situated somewhere here just around your throat, and this thyroid gland is very important for the overall metabolism of your body. It determines things like how fast your heart will beat, how your weight management goes through, your body temperature management, and several other things including your fertility as well. But one of the things that is the most important in the thyroid gland is called the thyroid peroxidase enzyme, and this is the enzyme against which we measure these antibodies. So what does this enzyme do? An enzyme is just a chemical that helps the body or the thyroid gland to actually make the thyroid hormones, and so this enzyme is very crucial for the functioning of the thyroid. In the next slide, I'll tell you what the thyroid peroxidase antibodies actually are and how this blood test actually helps us. Our body has a defense mechanism called the immune system, and sometimes this immune system tends to get confused. Now, I've already told you that the thyroid gland, which is something situated around this part of your throat, has inside it something called the thyroid peroxidase enzyme, and this enzyme is necessary to create the thyroid hormones which actually do all the work. Sometimes our body's immune system gets completely confused and begins to attack this enzyme itself. It thinks that this thyroid peroxidase enzyme is not something that belongs to our body but is some kind of an external agent or an intruder, and it creates proteins to fight against and destroy this enzyme. These are called anti-TPO antibodies or anti-thyroid peroxidase antibodies, and they are the ones that we actually measure in this blood test. As you can guess, these antibodies shouldn't normally be there, because if they were there, they would have killed this enzyme and reduced the ability of your thyroid to actually make the thyroid hormones. And so if these antibodies are found to be above a certain level, it definitely indicates a problem, and that's why this blood test, which measures the levels of these antibodies, is so important. So what are some symptoms that you might have that may mean that you should get this test done? As I already told you in the introduction, symptoms like feeling tired all the time, gaining a lot of weight suddenly, feeling very cold when others are in fact saying that the temperature is too warm, losing your hair, dry or flaky skin, constipation, continuously feeling depressed, and even tending to forget or having memory problems are all signs that there may be something wrong with your thyroid gland. And this is just one of the tests that your doctor will advise in a complete workup of your thyroid gland. So this is just a few of the symptoms. You may be having other ones as well, but here I've just included some of the most common symptoms. So if you're a patient who's been advised to get this blood test done, the anti-TPO blood test, you might be wondering, which diseases is this actually going to help me find? So here is a list of some of the most common diseases. The first one is called Hashimoto's thyroiditis. It's important for you to remember that almost all these diseases fall into the category of what we call autoimmune diseases, or diseases in which the body's immune system or our defense system attacks our own tissues. In this case, we are looking for antibodies which are going to attack our TPO enzyme, which is located inside our thyroid gland. So what are these diseases? The first one is Hashimoto's thyroiditis. It's a type of an autoimmune disease in which your thyroid gland gets destroyed and it cannot work properly, it cannot produce hormones properly, and because of that you tend to have all these symptoms, and these antibodies may be found positive in Hashimoto's. Another one is called Graves' disease, in which also there are these different classes of antibodies which are found in your blood. Graves' disease can in fact cause your thyroid to overact and not underact, because it tends to overstimulate the thyroid. But even in Graves' disease, we may find the presence of these antibodies. There is also something called subclinical thyroid monitoring, in which your thyroid may be diagnosed as just about functioning a little bit less than normal but not completely diseased. Even in that case, a doctor may advise you to actually get this test done. A fourth and a common situation is actually hypothyroidism assessment. Now this is a big long word. Hypothyroidism just means that your thyroid isn't working as well as it should. One of the reasons for that could be these antibodies which are attacking the thyroid, and so your doctor may ask you to get these antibodies tested. A goiter is a situation in which the thyroid swells up a lot. There are a number of different reasons why this could happen, including problems with your iodine intake, antibodies, autoimmune diseases. Sometimes it just happens without any cause, but your doctor will definitely ask you to get your anti-TPO antibodies done as a part of a broader panel of blood tests to know what is the reason for this swelling of your thyroid gland, which is also called goiter. So these are just some of the diseases that we can try to diagnose. But you have to remember that TPO will rarely be advised alone. You won't have to just do this one test. There'll usually be a long list of tests, one of which will be the anti-TPO antibodies. So how is this anti-TPO blood test done? Well, it's just a simple blood test. You have to provide a single sample of your blood. You don't need to be fasting before this test. Some of the labs will ask you to avoid having any biotin supplements around 2 to 3 days before you provide your sample. This is because biotin has been found to interfere with certain lab technologies which are used to measure these hormones. In fact, biotin is pretty now well known to be an interfering factor for not only this test but many other tests. So they'll just tell you not to have any biotin supplements. Other than this, you need to remember that you can give the sample at any time. There are no real precautions that you need to follow, and you should usually receive the results either on the same day or on the next day. What is the normal range of the anti-TPO test? The normal range should be less than 9 international units per milliliter of blood. This range is based on an internationally accepted value which is used in certain countries. Please note that in your lab and in your country, the value may be completely different. Definitely cross-check with the report that you have at your own lab. Ask them what their normal ranges are. It will definitely be also mentioned in your report. This is just a reference that I am providing. So to end, which are the diseases in which or the conditions in which these anti-TPO levels may be higher than normal? So as I already told you earlier on, it's just probably the same list of diseases that we are going to try to detect. So if you have Hashimoto's thyroiditis, it is very likely that your TPO levels will be way higher than normal. If you have Graves, again, your anti-TPO levels may be much higher than normal. If you have type 1 diabetes, sometimes patients with type 1 diabetes, which is in itself an autoimmune disease, may also have associated thyroid problems, and this antibody level may be elevated in them too. You may also find this in association with autoimmune diseases like lupus and rheumatoid arthritis, which are basically both diseases in which your body's defense mechanism attacks itself. So both of them fall in the same category, and your TPO levels may be raised if you have either of these two diseases. Lastly, if you have a family history of thyroid problems, maybe someone in your immediate relatives, your mother, your brother, your father, a first degree relative is a known case of thyroid problems, it may be advisable for you to also get this tested, because sometimes we find these familial relations also. So these are just some of the situations in which the value of the TPO will be much higher than normal. Remember, we are only concerned if the value is actually above what is expected to be normal. There is no such thing as a value below normal, because these antibodies are normally not present. I hope this video has helped you. If you have any questions, please add them in the comments, and I'll do my best to answer them as soon as possible. Thank you.